Hello, I'm Kim Snowdon, Chief of Medical Services here at the Oakland County Health Division. Joining me today is Dr. Ivacko, a neonatologist from Trinity Health, St. Joseph Mercy Ann Arbor. Welcome, Dr. Ivacko.
Thank you for having me.
In Michigan, the increase in syphilis cases, specifically congenital syphilis or CS, is alarming. According to the Michigan Department of Health and Human Services, the number of women in Michigan diagnosed with syphilis has increased by 5 times. Dr. Ivacko, is this a trend we're seeing across the country?
Yes, primary and secondary syphilis cases in women of reproductive age are rising in the United States, and in parallel, CS cases have too. From 2016 to 2020, cases of congenital syphilis increased by a staggering 235%.
Wow, that data is startling. With the surge in syphilis and CS cases, what can healthcare providers do to reduce the rate of this disease?
Well, the best tool we have is to test our patients for syphilis. So always test women who present with a symptomatic syphilis infection or have a known exposure to syphilis. Test them if they're asymptomatic for syphilis, but present with other STIs or for STI testing. And test them if they are pregnant. All pregnant women should be tested in their first trimester and again early in their third trimester. If the mother wasn't tested at least once for syphilis during her pregnancy, she should be tested at the time of delivery. And then in addition to testing all pregnant women for syphilis, providers can also take a complete sexual history of their patient, discuss preventative actions to lower their risk of contracting syphilis, treat women infected with syphilis immediately, and quickly report all cases of syphilis and congenital syphilis. And this should really be done within 24 hours.
This is all such great information, and it's important to note that all positive tests are reported to the state.
Providers can also become more aware of STIs, so it's on their radar when examining and treating patients. According to the CDC, 1 in 3 physicians have not received any post-medical school training in STIs, and that puts these providers at a distinct disadvantage in diagnosing and treating these infections. Not treating syphilis quickly and properly can lead to visual, auditory, and neurological problems for the patient. Babies born with congenital syphilis can die from the disease or be born with deformed bones, enlarged organs, meningitis, or brain and nerve issues.
Dr. Ivacko, I'd like to thank you for joining me today and talking about such an important topic. For everyone out there, resources like STI treatment guidelines and the National Network of STD Clinical Prevention Training Centers information for providers can be found at cdc.gov/STD. Make syphilis testing part of your patient's regular STI screening and counseling today. Thank you for listening and have a great week.